Hello, this is Mike DeBishop, and welcome to this snapshot on compounding. This snapshot is part of Module 5 of the MCW School of Pharmacy Wisconsin MPJE Review course. Compounding is governed by both federal and state statutes and regulations. First, let's take a look at federal governance of compounding. On a federal level, the Food, Drug, and Cosmetic Act and FDA regulations govern the practice of compounding. Historically, these efforts have tried to maintain a balance between the profession of pharmacy's traditional compounding role and ensuring the safety of compounded products. The statutes and regulations involved have been evolving continuously over the past about 30 years or so, and they still continue to evolve today. Currently, we can think of pharmacy compounding for humans in two different types of practices. The first is the 503A compounding pharmacy, and this can be thought of as your traditional retail community pharmacy performing compounding for a individual patient. And then the more recent 503B type of compounding, and these are the larger scale compounding operations that compound in large amounts and ship compounded preparations to multiple sites across the country. And we'll talk about each of these types of operations in turn. So as I mentioned, the 503A compounding pharmacies are your typical community or retail type pharmacy, and they apply to the vast majority of state licensed pharmacies, although they can also be federal facilities as well. So no separate license or notification to the pharmacy board is required. For this type of pharmacy, they may compound human drug products that are pursuant to a patient-specific prescription, so one compound at a time. On a limited basis, they may compound extra quantity ahead of time, but only based on the history of receiving prescriptions for that compounded product. So if a pharmacy has a history of receiving several prescriptions for a compound within a couple of weeks or a month, they may compound a limited amount ahead of time, anticipating those prescriptions. However, they may only dispense a compound pursuant to a patient-specific prescription. They may not compound in bulk or for office use at a physician or other practitioner's office. Substances that are used in compounding in 503A pharmacies must be present in the USP or National Formulary, or be present on the what's called the FDA Bulk Drug Substances List. Finally, for a compound in a 503A pharmacy, the Beyond Use Date, or BUD, can be assigned based on internal pharmacy-specific data or external data according to the literature. And Wisconsin's compounding regulations give some guidance on BUDs for certain types of compounds that are made in a 503A pharmacy, and we'll talk about those in a little bit. In contrast, 503B compounding facilities, which are also known as outsourcing facilities, and that is a federal designation, outsourcing facility, are a relatively newer type of compounding operation. This designation, the outsourcing facility designation, was created in response to the New England Compounding Center tragedy in 2012, where contaminated batches of IV solutions were shipped across the country and resulted in multiple deaths. These outsourcing facilities are or may be registered as a pharmacy, but they do not have to be a state licensed pharmacy facility. They may compound human drug products in bulk, so they may compound large amounts of sterile or non-sterile compounds. If they are a pharmacy, they may also compound due to a patient-specific prescription as well. So the main role for these is that they typically operate by compounding large amounts of sterile preparations, occasionally non-sterile preparations, for shipment to offices across state lines and again around the country. Therefore, 503B facilities may be considered to be able to compound for office use, in contrast to a 503A facility. Right now, as of the time recording this, none of these 503B outsourcing facilities have yet been registered in the state of Wisconsin. 503B pharmacies have other important requirements that somewhat parallel those of a pharmaceutical manufacturer. So for example, they must register with the FDA at one location. They must comply with current good manufacturing practice regulations, as well as submit to FDA inspections. In addition, they have to demonstrate the quality and stability in-house of all the products they make. So they must use their own internal data and cannot use literature-based data for things like beyond use date and storage requirements. If they use bulk drug substances, they must use only those that have been approved by the FDA for 503B compounding specifically, and report the list of their compounded products to the FDA on a biannual basis. And then finally, they are subject to the labeling requirements of the Federal Food, Drug, and Cosmetic Act. So 503A and B compounding pharmacies do have a few restrictions in common. Neither of these may compound using drugs that have been previously withdrawn from the market commercially. They cannot compound inordinate amounts of products that are essentially copies of commercially available drugs. So they can compound things that are just a little bit different from commercially available drugs if there is a medical need for those, but they can't take a marketed drug and create their own version of that. Finally, they can't compound drugs that present compounding difficulty from a technical standpoint, and if this difficulty could potentially affect the safety or efficacy of the drug. So this table summarizes some of the important differences between 503A and 503B compounding, and we'll put this again in a PDF within the site for easy reference as well. And finally, just a word on vet compounding. And so this is a bit of a gray area right now. The FDCA does specifically permit compounding of animal drugs by a veterinarian or a pharmacist, but only when the source of the active ingredient is a finished FDA-approved drug. So they have to take a FDA-approved drug and compound that in some way for that to be permitted by the FDCA. Currently, there are still evolving and somewhat complex regulations and guidance for bulk or office use vet compoundings. Remember, though, that 503A and B are specific to human drug products, and so those restrictions don't necessarily or always apply to vet compounding. A few caveats to keep in mind, and these are caveats that apply to compounds in general, or excuse me, prescriptions in general in Wisconsin. So no prescriptions for controlled substances for office use are allowed in Wisconsin, and this applies to compounds as well. So even a vet or another practitioner cannot write a prescription for a controlled substance compound. There are specific labeling requirements for compounds. We'll talk about these just a little bit later on in this module. And animal patients have specific label requirements, and those requirements were discussed back in Module 4 and can be found in FAR 7.04. So with the federal picture of regulations for compounding in mind, let's take a look at a few of the regulations that we'll find in Wisconsin related to compounding. In Wisconsin, FAR 15 regulations provided additional extensive guidance on appropriate compounding facilities and equipment, the record keeping that needs to be maintained, training that needs to be done for compounders, checking as well as component selection. And there are sections on both non-sterile as well as sterile compounding. Some of the sterile compounding regulations are covered in Module 7 in the inpatient section. And we're going to cover a few of the highlights of the non-sterile compounding requirements here in these slides. In addition to other labeling requirements, compounds require a few additional pieces of information. So FAR 7 has extensive labeling requirements for all prescriptions on compounds. The label must also contain, in addition, the appropriate storage, the beyond use date, any special handling requirements, and on the prescription label somewhere, the indication that the prescription is a compound and not a manufacturer's finished dosage form. So please know these labeling requirements in addition to those for other prescriptions. The regulations provide some guidance on beyond use dates when no other information is available. First of all, for non-sterile compounds, if there is stability information in the literature, those can be used. However, in the absence of any stability information, these are standard beyond use dates for these types of compounds. So, for example, a non-aqueous formulation at room temperature can be given a beyond use date of 6 months. For aqueous preparations, an oral preparation in the refrigerator is good for 14 days, and a semi-solid, so a cream or ointment at room temperature, is good for 30 days if it's at an aqueous base. So these are some good beyond use dates to know and to remember for non-sterile compounding. Obviously, if any component has an earlier expiration date, that date must be used instead of these standard ones. Wisconsin regulations specify a few requirements related to the order, labeling, and documentation for non-patient specific compounding. Now remember, this is only for 503B facilities or occasionally for veterinarian compounding. 503A pharmacies can only do patient-specific compounding. So for non-patient specific compounding in these situations, the order must include the practitioner's name and address, the drug name, strength, and quantity for compounding, as well as the purpose of the compound on the order. On the label, the practitioner's name must be included. There is no patient, so it has to be the practitioner's name. And the following statement: for practitioner administration only, not for dispensing or distribution. And if it is a single-use compound, the designation that it is single dose only. In the pharmacy, the pharmacist ensures that the record of all compounds distributed to the practitioner are kept and include the name and address of the location to where they're distributed, so usually the practitioner's address, the beyond use date, and a pharmacy-generated lot number for all of these compounds. So we have order, label, and documentation requirements for non-patient specific compounding. It is important to note that this is a federal as well as a state interpretation, that any reconstitution or mixing of prepackaged ingredients that, according to manufacturer directions, is not considered compounding and is not contemplated under federal or state compounding regulations. And so this includes things like reconstituting a a bottle of antibiotic powder, so like an amoxicillin suspension, or mixing creams or ointments under manufacturer's directions. And an example of this would be benzomycin, where a little bit of mixing is required before dispensing. So these are not considered compounding and don't fall under compounding statutes and regulations. So thanks for being here and learning a little bit more about compounding through this module. It is part of the MCW School of Pharmacy, Wisconsin NPJ Review Module 5, and additional practice can be found in the companion questions associated with this module. Thanks, and I'll see you in another snapshot.